Hi, this is Dr. Roger Moore, here to answer the question, what do I need to know about melanoma? This is a great question and it's important for each and every one of us. The reason it's important is because melanoma can be deadly. It arises often in a new or changing mole, and many of these are actually dark, although they don't always have to be dark and they don't always have to be on sun-exposed sites. We want to look at melanoma and make sure that we know what to look for. In evaluating this, we want to make sure that we understand the A, B, C, D, and E's of malignant melanoma, the skin cancer that arises from mole-type cells. The ABCDs actually remind us that if a mole is asymmetric, has border irregularity, color variegation or multicolored, or has a diameter greater than 5 millimeters, or it's new or changing, evolving, then you want to be concerned about it. So when we look at this a little bit more closely, what we'll find is that asymmetry means that you cannot take a mole and flip it over and fold it in half and it match up perfectly. So if you can't fold it in half and the sides match up exactly, it's going to be somewhat asymmetric. It may be as simple as having a notch out of it, or the mole itself might be somewhat irregular. Now, the border irregularity is actually B. When we think about the border irregularity, we really want to be looking at a mole and seeing how smooth are the borders around the edges. Are they scalloped or notched? If the answer is yes, you want to have it looked at. Even though the color might be even throughout a mole, if the edges are somewhat irregular, jagged, or those edges just don't look right to you, come on in and have it looked at. C stands for color variegation. We're talking about color variegation really mean that it has multicolored. So any mole that is brown, black, red, blue, or gray would have some concern to it. And sometimes if they have multiple colors to them, they may have a base of one color but then have some darkness speckled in with it, or maybe a gray color. That would be termed color variegation. Now the D represents diameter, and that means a mole that is going to be a bigger size, oftentimes than 5 millimeters. That's generally bigger than a pencil eraser in size. So if it's bigger than a pencil eraser in size, consider having it evaluated. It doesn't have to have a lot of other features to it if it's bigger than 5 millimeters and it's new or changing. Now E stands for evolving, and that's our way to remember that if we have a mole or growth that is new or changing, regardless of color, you should have it evaluated, especially if it's persisting for more than a month. Does that mole change? That would be important, and you should get it checked. An evolving mole or a new or changing mole is one of the key risk factors. In fact, the highest level risk factor in many cases is a new or changing mole. Now, when we think about malignant melanoma, we also have to realize that anyone can get this. When we're looking at the skin, you're looking for the A, B, C, D, and E's of melanoma. You want to be familiar with this, but you also have to be aware that with malignant melanoma, you can potentially have skin cancer on any site of your body. So you need to get evaluated periodically. If you find that there's a mole that bothers you, or you're looking at a spouse or loved one and you find one that fits any of the criteria of the ABCDs, come on in and let us look at it. It's important also to know that some malignant melanomas are termed amelanotic, meaning that they don't have color to them that we would normally think of for a mole. They're often pink, or they can be more of a tan or white color, sometimes even gray. So even a pink bump that doesn't go away, you want to have it looked at and make sure you're on the right track. Any new or changing mole can be a risk factor. So that's one of the things you want to take home when you're thinking about your skin and those that you love. A suspicious growth is best evaluated, and any sore that won't heal would be important. And remember, these images that we're showing are samples of skin cancer, and they don't replace a professional annual dermatologic exam. You should come on in and get your annual dermatologic exam, because the more that you can take care of yourself, the more you can prevent and catch early skin cancer. It's important to realize that the most important thing you can do is look at your own skin. The most important thing we can do is to be here to help serve you and make sure that you're finding success in your future. Evaluation by yourself and by your dermatologist could save a life. Most importantly, yours. Thank you. I wish you much success, peace, and happiness.